Dr. Kathy again. How are you today? All right, so I have a very interesting questionnaire here on sexual satisfaction by the NIH, National Institute of Health. Go figure, they have an extensive questionnaire or evaluation or a measure that they are able to provide to the public so that you can have an idea of where you stand sexually in terms of function and satisfaction. I think this is one of the most extensive and comprehensive evaluations I've seen. Very, very proud of the NIH for delving into this and giving us access to this information. So I want to share a bit of it with you because it's so important for you to understand that not only is it important for you in your relationship, but even the National Institute of Health, one of the biggest organizations of health in the government, cares about your being able to function sexually because it has a huge impact on your health overall. We said it before, right? Longevity and quality of life improves with great sex. So health gets better, life gets better, quality of life gets better, sexual satisfaction, and your relationship is long lasting. And that's what we want, right, in the long term. So I want to start with what the name of the program is. It's called PROMIS, PROMIS, which stands for Patient Reported. So it's coming from you. You, the patient, is going to give us what you're going through. It's not us asking questions. It's you giving us a reading of what you're going through. So this is all really related to you and what you're feeling and experiencing in the bedroom. And I love this. So patient reported from you outcomes measurement information system. That stands for PROMIS, PROMIS. Patient reported outcomes measurement information systems. And the name of the questionnaire is Sexual Function and Satisfaction Measure, or SEXFS. Sex FS is function, satisfaction is the S, so SEXFS. And what they're measuring is a range of sexual activities, activities in the bedroom, symptoms, what you're feeling, functioning, how you're functioning, whether you're doing it well or not, and evaluation of experiences, how you experience it over the last 30 days. So we expect you to have sex in the last 30 days, right? For those of you that are not, let's do some improvement with that. So we want you to have sex and we want to know what you're experiencing in the last 30 days. And I really hope you are having sex in the last 30 days at least. And if you're not, please see somebody like me, see your primary care doctor that can help and figure out why that's not occurring, because it might be a medical issue, right? Or there might be some, social issue or some relationship issue. So please get some help from a therapist or from a psychiatrist or psychologist, okay? So you see that it wants to know what's going on right around 360, right around the whole sexual issue. Again, I love that too. So I want you to understand that it is not just one aspect of sex that we're looking at, it's the whole picture, okay? And the domains, the measures are quite a few, as you can see. And I'm going to actually just read them out. I'm going to actually define them right here because I have the actual manual here to define them. So the measurements, the domains are screener items. So it's going to screen and see whether you're actually having sex, okay? Interest in sexual activity. It's going to ask, are you interested in sex or not, okay? Satisfaction with sex life. We want to know whether you're satisfied with your sex. It's going to give it to you on a scale, okay? So they're going to give it to you, you answer it, and again, it's going to be on a scale depending on whether it's no, 0, or all the way yes, and how satisfied you are with that, okay? And I'm going to put in real quickly that these questions, we don't have to do them all. We can just choose and focus on one or two sections or areas. They have so many sub-questions. Again, these are the domains. In these domains, they're going to have several questions and subsets and sub-questions that you're going to have to answer regarding these measures, okay? And so we can just choose one or two areas if we want to, depending on the area that is an issue with you. And what I like about this is I can actually treat you. Let's say give you some hormones or give you some herbs or supplements, and then actually repeat the same questionnaire, the same measure, the same domain, and find out whether you've improved or not based on my treatment. Isn't that wild? So this is a great tool, and we can do this with most questionnaires, but this one is really designed to do that, to really compare what you're doing after an intervention, okay? So after satisfaction with sex life, we have orgasm ability. It wants to know, are you able to have an orgasm? Orgasm pleasure. It wants to know the intensity, how much pleasure you're getting when you do have your orgasm. Okay? Erectile function. For the men, they want to know whether you're actually functioning well when you're having that erection. Vaginal discomfort. Any pain, any issues that you have that we are not aware of, they want to know also. Clitoral discomfort, the clitoris. You know I love the clitoris. Any problems with the clitoris? Is it sensitive? Is it hypersensitive? Is it not sensitive at all? Is it painful? We want to know because it's very important. Remember, one of the key organs for your orgasm. Labral discomfort, the labia, right? The outer lips, the inner and the outer lips. Are you having discomfort? Is it too big? Is it too small? Is it too tight? Is it too dry? We want to know. Vaginal lubrication. That's the secret, right? Are you lubricating vaginally? Anal discomfort. Any anal discomfort when you're having sex. Again, that is, I think, for any orientation, anyone can do this. So please understand that this is whether you're using it as a heterosexual or as any other bisexual or homosexual. So you don't have to just be one particular orientation to do this questionnaire. Oral discomfort. So they want to know about the oral, the mouth, any problems when you're having sex orally. Oral dryness. Is it dry? That can be uncomfortable. Factors interfering with sexual satisfaction. What factors are interfering with sexual satisfaction? Are you worried about the kids that are in the house? Are you worried about the bills? Are you worried about finances? Are you worried about your work? Is that interfering with your sexual satisfaction? Therapeutic aids for sexual activity. Toys, right? They're really interested in the toys. Or medications or anything else that you're using that might be relevant to making sure that you get sexually satisfied. The sexual activities, they want to know what you're doing in the bedroom. I love that. Whatever it is that you're doing, they want to know. And they want to know whether that's giving you pleasure or not. And then they want to know what bothers you regarding sexual function, whether you have any issues that are really bothering you too. So that's pretty much a nice roundup of what they are looking at. And I'm going to define these for you because I think this would make it easier for you to be even more understanding in terms of what they're looking for. And remember, why I'm doing this is for you to have an angle and a view, a perceptive view of how you are in the bedroom. Because if you don't exactly know what to look for, you might be lost. So this, again, zooms in and allows us to focus on what you should be looking for in terms of sexual satisfaction. All right. So the first one was screener items. Screener items asks about sexual activity in the past 30 days and reasons for not having sexual activity in the past 30 days. So if you're not having sex in the past 30 days, they want to know why. And again, we doctors can, again, take different areas and focus on it. So let's say a psychiatrist just wants to know why you're not interested in sex. And this could be going back into your, youth, way back into your youth. So who knows what the reason is. But again, a psychologist might want to use this particular angle to delve into why you're not interested in sex, again, depending on how bad it is. Okay. So the screener item is the section where they're going to go more into why you're not interested in having sex. The second one, interest in sexual activity, assesses a conscious awareness of wanting to engage in sexual activity during the past 30 days. Okay, meaning if you are interested in sexual activity, if you're interested, they want to know how interested you are. Are you really, really excited about it, or you're so-so? Okay, again, we've seen this in other questionnaires. Satisfaction with your sex life. They want to know overall, are you satisfied? And here they're assessing how satisfying and pleasurable the person regards his or her sexual life in the past 30 days overall, okay? With no limitations on how the person defines sex life. You can define it any way you want. Overall, they want to know how do you regard your sex life, okay, in the last 30 days. Next, we have the orgasm ability. They define it here as assessing the ease with which a person has been able to have an orgasm over the past 30 days. How easy or how difficult is it for you to have an orgasm? That's really, really important, right? Can you get it like that? Or it takes a long time, or you can't get it at all, right? So it's very important to know because they want to know whether you're able to. And again, we know a lot of women cannot, right? And some men cannot, right? Orgasm pleasure. They're defining this as assessing how pleasurable or how satisfying the person's orgasms have felt in the past 30 days. Erectile function assesses the frequency and quality of achieving and maintaining an erection for sexual activity over the past 30 days. Okay, again, I want to define these for you. Vaginal discomfort with sexual activity assesses physical discomfort of the vagina during and immediately following sexual activity, including sensation of pain, rubbing, burning, pulling, or ripping experienced over the past 30 days. Isn't that important? They want to know, are you having any pain? Are you having any rubbing? Are you having any pulling or even ripping sensations in the last 30 days? Because that is going to tell us something else is going on that we've got to figure out, right? Vulvar discomfort with sexual activity. And they're talking about the area of the vagina, which is the vulva, right, where the lips and the clitoris is. So this angle is the clitoral assessment, meaning the degree of physical comfort, including pain of the clitoris experienced with sexual activity in the past 30 days. They want to know. They also want to know about the vulvar discomfort with regards to the labia. Assesses the degree of physical discomfort, including pain of the labia, the lips, experienced with sexual activity in the past 30 days. Are you having any pain in the labia? Isn't that interesting? Some people can have pain in the lips alone, okay? Especially if it's too big, it's too small, too dry. It can be very, very uncomfortable. Anal discomfort assesses physical discomfort, irritation, pain, or bleeding around the anus or rectum during or after sexual activity over the past 30 days. Okay, so this is gender non-specific. Remember, we said that. Oral discomfort with sexual activity. I love this one because I've not really seen that in other questionnaires. Assesses the degree of physical discomfort in the mouth, including pain and or irritation experienced with sexual activity in the past 30 days. And then the next one is oral dryness with sexual activity, assessing the lack of saliva, huge, in the mouth experienced with sexual activity in the past 30 days. All right? What does that mean? Some people don't produce a lot of saliva. We know that. And so we can get lubes, natural lubes to help with that. But it is important because they do want to know whether it's regarding a medication or it's new or it's old or it's chronic. They just want to know because it's important because in sexual activity, you do need to be lubricated. And this is part of lubrication in the mouth. Factors interfering with sexual activity is a collection of items each of which assess the person's perception of the degree to which various factors affect their satisfaction with sex life in the past 30 days. These include symptoms of disease. And that's another perspective, right? That we haven't really talked much about, but the NIH wants to know and wants us doctors to know, because this is for us to help evaluate you and help you get better. They want to know whether you have some disease that's interfering with your sexual activity, and there are quite a few that can. Is there a side effect from a treatment that you're receiving? Are there other experiences that have been identified by you interfering with your sexual activity and your sexual satisfaction? Very important that you communicate that to us. So we want to hear from you, not just ask you some questions and miss the most important thing that you're experiencing without you telling us that. Therapeutic aids for sexual activity is a collection of items, each of which assess the use in the past 30 days of hormones, love my hormones, natural hormones, personal lubrications, medications, or devices intended to allow for or improve sexual function. Nice. They want to know what to use in the bedroom, including toys or pumps or prosthesis. There are things that we can use or injections that can help the men and women in terms of hormones sexually, or even tablets, right? Supplements, and we have creams. Sexual activities is a collection of items. So sexual activities is a collection of items, each of which assess the frequency of engaging in specific affectionate or sexual behaviors, either alone or with a partner in the past 30 days. So engaging in specific affectionate or sexual behaviors, the acts, either alone or with a partner in the past 30 days. So masturbating would be included here. So they want to know, what have you done in the past 30 days? And the last one, which is bother regarding sexual function, and we had that here, bother regarding sexual function. They define it as a collection of items, each of which assess the degree of bother people report for each specific aspect of sexual functioning in the past 30 days. So there's a particular issue that will happen, and it might go fleetingly by, just go in and out and just gone, and you might not pay attention to it, but they want to know what bothers you, anything that comes to mind, and they want to know in terms of the last 30 days, because they want to know whether it's something that is mild, moderate, severe, that might be interfering with your sexual satisfaction and your sexual functioning. Okay, so I love the fact that the promise has this ability for us to choose. Again, we can go into one particular group or a cluster of groups of these domains and focus on that with regards to you, the individual. We can customize it, which is what I love. And we can also do a treatment or intervention and repeat this questionnaire and see how you do afterwards. I think it's a great, great tool for us to use. And guess what? We have the website here, www.healthmeasures.net, or you can actually go take a peek of it. They have some videos, they have some examples there, and they have people you can talk to at the NIH if you have some questions regarding this, okay? And maybe find a doctor in your area that will be able to help you do this evaluation with you in their office. So I thought that was great. I think this is done, my sexual satisfaction. We're going to talk about something else tomorrow, but I really hope that you learned something today, and I really hope that you'll be able to understand this is by the NIH, which means nationally, your sex life is important to them too. Okay, guys? All right, good to see you. I'll see you tomorrow. Take care. Good night.